Welcome to the Healthcare Marketing Mindset Rehab. If you're here with me today, you want to learn how to change your mindset about marketing so this way you can improve your outcomes. You want your sales and marketing teams to be in sync, and you want to create marketing that really connects to the audience that you're focused on. My name is Kat Vai. I've been in the healthcare marketing industry for about 30 years, and I'm really passionate about healthcare and about marketing. Today, we're going to focus on marketing mindset. What does that mean to you, and how does that exactly change how you are doing your marketing and how you're thinking about marketing so this way you can do better? I went back in the early days when I started in marketing. I always worked with folks that I felt didn't really understand marketing. And I think that in many cases, many people today don't understand marketing. And if you don't understand something, how can you measure it? How can you make it better? If you don't understand and have the right mindset about marketing, then you think it's one thing when it's actually another. What does that mean? So many times people think marketing is like a light switch. You just go into the room, you click it on, and the marketing is there and flowing and creating leads like, gangbusters. Now, if you don't have good marketing, or you don't have a system in place and you don't have a strategy, and you're really focused on just a lot of tactical elements, that light switch, when you turn it on, it's like if instead of the light immediately coming on, imagine the power plant is miles and miles away, and when you hit the light switch, suddenly the light, the energy, whatever, had to slowly start coming over. Another way to think about it is I call it priming the pump. Back in the olden days when they had pumps out in the field, in the well, in order to get that water up in the pump, you had to start priming it, which meant you start having to move the pump so this way the water could come up and start to flow. And the more you pumped it, it would continue to flow. If you stopped pumping the water, you would still have some water flow, but then eventually the water would drain back down. And in order to get that water to start flowing again, you'd have to prime the pump. And that's what marketing is about. It's about priming the pump and keeping the pump going so this way you can have the type of marketing that you want. What happens is that if sales is having a bad day or a bad week and things are not coming in, and suddenly there's a panic and we need more leads, we need more opportunities, and they look over to marketing and they're saying, hey, marketing, how come you're not giving me a promotion? You know what? I do need a promotion. Get that promotion done. And if your mindset about marketing is that they are order takers and not strategic partners within the company, they're going to go out, make a promotion. The expectation is that there's going to be immediate results, and they just won't be there. I always often tell salespeople, imagine if you just walked into a client cold and you said, or potential client cold, and you said, hey, I have this great solution. I'm telling you, I have people that love it. They're ready to, they get great results. And, you kind of go down the laundry list. You talk about pains and so on. What's the likelihood, especially depending on the price, if there's a high price point, if there's a lot of pain related to making that decision, if there are more than one decision makers, it's the likelihood is that that's just the beginning of the conversation. And you have to have multiple conversations in order to get that sale made. It's the same thing with marketing. When you first start with marketing, you're igniting a thought. You're telling someone that may not have even known that they had a problem, that they're having a problem. And then you're providing information and data points so they can research. And then you're connecting with them and you're starting a dialogue and you're helping them helping them to trust you more. So that's a process, just like walking in the sales into somebody cold. It's the same thing with marketing. And so you've got to have the right mindset. So your expectation is in the right place. And so this way you guys can be successful. The other thing is the mindset is not waiting to do your marketing when you need it. You need to get that pump primed so this way when you need it, you do have your marketing flowing and working as it should. So, you know, the reason I'm so passionate about mindset and about helping people understand that if they don't have the right mindset about marketing, that they will always have a challenge, is because, again, my first job, real job, I should say, was in healthcare. My mom, she worked at Life Extension Institute in New York. She was a medical technician. And my older sister was getting a divorce, and suddenly she needed a roommate. So I had to, and I wanted to, move in with her to help her pay her rent. Before that, I was living at home and, living the good life. I was finishing up school. But I needed a job, and I needed one that was paying pretty decent. So my mom got me connected, and I had an interview, and I was working at this executive clinic, is what they called it, down on Madison Avenue, across the street from St. Patrick's. It was a beautiful area, and I loved it, and it was a beautiful building. I worked there, and I really, enjoyed seeing my mother work there and how she interacted with people. And I learned working at this clinic on how to interact with people. I was a psychology major at the time. I minored in business, and I really made an effort to understand people and what would set them off, and how to engage with them, and really learned how to talk to people in terms of customer service, because I was at the front desk before I became the manager of the clinic. And I would have to speak to people that, they were coming in for immigration exams, and they didn't know how to, do the information, or they didn't speak English and their interpreter didn't come, or they were coming in for, AIDS tests and things like that, just a myriad of things. And you had to really learn how to speak to people and get them processed and get the payment and keep them calm, because sometimes there was long waiting times. It was a beautiful, beautiful clinic. So we had a lot of high volume from a lot of the people that worked within the building. We were on the 34th floor, and so there were offices above and below. And then later in the years, my another reason, let me step back a little bit. I love that, and I didn't understand while I was working there. I didn't understand how they marketed the organization. I always thought that they could do better with the marketing, because if we could get more people walking in, not just for the immigration exams, but for small health visits within the clinic space, I think we could do much better. And I always try to utilize what I had learned in college in the business and marketing side and the psychology side, to try to help support that and create that. Later, I worked in the on the operations side. I was this assistant operations director, and that was really great. I learned a lot of the back end. I learned the purchasing of clinics. I learned to work with doctors and speaking with them, and the importance of something as simple of getting lab coats for these doctors that fit perfectly. You wouldn't think that was important, but for them, that was extremely important. I mean, the sleeve length had to be perfect. They had to be super pressed, and, just things of that nature. And I really got a sense of how nurses and doctors and patients each were so different, and how you communicated with them was so different. Later, we had a tragedy in that my sister, she contracted, or not contracted, but she got lupus. It's an autoimmune disease. We have that in our family. Hers represented and showed itself as lupus, and it really, damaged her kidneys. And it was really touch and go with her for a long time. And, her first big struggle, she came through, and her kidneys were very much damaged. And we knew that it was only time before they both would shut down. And I remember when they did, she started peritoneal dialysis, and she wasn't very strong at that time, so she couldn't go on the kidney transplant list. She had asked me, "Hey, do you want to go on the list?" And I said yes, but I was very nervous about it. You think to yourself that you want to help and you are super altruistic, and you're not going to worry about those things. But I'm a human, I'm mortal, and the thought of giving a kidney just seemed scary to me at the time. But I worked through it. I gave her the kidney, and watching within that process, the many years process, I saw doctors that weren't too good and doctors that were fantastic, and what difference that made to the experience. The doctors that had access to great technology versus the doctors that didn't, you could see how it helped them, with communication, with prescribing the right medicine or getting the right tests, and so on and so forth. So, working in marketing in the healthcare space, to me, is my way of helping physicians, in that if I can help an organization that is selling a service, technology, a solution to a physician or hospital that will make their job easier and better and faster, or provide more information, because ultimately it's going to help the patient. And that's what I'm very, very focused on, making that connection and helping get those solutions to the right people in the right places, so patients can ultimately live better lives. And that's my small contribution. So for me, really understanding how to deploy marketing in a successful way is super important. And the first step is understanding what marketing is, what it does, and how it can help the organization. And what it does is it helps ignite interest in your solution, and it creates access to information and allows the trust, allows the amount of trust to be built quickly. So this way, when the sales steps in, they can have an easier time with the process. So changing your mindset about marketing, and from marketing being order takers to strategic partners that can ask questions, that can dig deeper, and that are working to build a strategy early on. So this way you have that flow of information, of data, of promotions, of messages that are consistent throughout, the year or your quarter, is so, so important. And I'd love, and later I'm going to share ways that you can make that happen. I have a lot of great information to share from over the years. I'm working on a little book that will be ready soon. And I said that last month, but I promise it will be ready soon. And I look forward to, doing that. So thank you for joining. I know this is a quick little program, but I think it's just enough to give you quick bites of information, because I want your healthcare marketing to succeed and to work. So you've got to get that mindset, and we've got to get it a mindset rehab. So this way your marketing is really supporting and really helping you do what you need to do. So thanks for joining me, and I look forward to seeing you next time on the Healthcare Marketing Mindset Rehab with Kat.